Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. This program is supported by San Juan Regional Medical Center, who's expanding its services to offer low-cost blood screenings all year round, now offering walk-in convenience to get the blood tests you want when you want them. MyLabs, patient-ordered testing, is available in Farmington at the hospital's laboratory and the Outpatient Diagnostic Center on 30th Street. Also in Aztec at San Juan Health Partners Family Medicine at 120 Llanos Street. With nearly 20 tests available, there's an option for everyone. MyLabs, patient-ordered testing, a wellness service of San Juan Regional Medical Center. But let me turn to my guests who are here with me in the studio this morning to talk about Patient Safety Week at San Juan Regional Medical Center. Suzanne Smith is back here at the KSJE studios, the Chief Nursing Officer. Good morning. Welcome back.
Good morning to you, Scott. Thanks for having us.
You bet. Thanks for being here. Also, Cindy Baez is here. Good morning to you.
Good morning.
Good to have you here as well. You are the Clinical Director of Nursing for the hospital, so it's good to have you here. And also joining us here in the studio is Cynthia Brandt, who is the Director of Laboratory Services. Good morning to you.
Good morning, Scott.
Thank you all for coming in this morning to talk a little bit about this. And so, Suzanne, let's start with you about what is Patient Safety Week. We're celebrating it right now.
Yeah, Patient Safety Week started on Sunday of this week and runs through the week. And we put particular attention really to, I think, to accomplishments that have are faced or that we face and we put forward for patient safety. Obviously, patient safety is of paramount importance all year long. We just celebrated a little bit this week.
And when we talk about patient safety, we're talking about what types of things? Just making sure that they get the care that they expect when they come to the hospital, or there's much more than just that, I suppose.
It's those things, but it's actually a little bit more. It's really about, in many respects, prevention of things that are adverse effects that could happen in hospital environments. There are risks for infection or for things like a deep vein thrombosis. When people are in bed for long periods of time, they're at greater risk for that. And so the things that we do in order to prevent anything that could happen to an individual in the hospital. Patient fall is probably a real significant one and something maybe that people might be more familiar with.
Right. We don't always think about some of those other things that could happen.
Right.
We're just going there to get better and then we want to go home. But there are lots of other opportunities for potential problems, I suppose.
Absolutely.
And so this means that the hospital then takes this, I know, very seriously. And so there's a lot of, I guess, training involved and just reminding people about this whole idea of safety when patients and visitors are at the hospispittal.
Yeah, there's a lot of focus on that education that is toward prevention. And so really from all staff persons. So it's not a responsibility of just the nursing staff, but it's a responsibility of all staff members. Every one of us is responsible for being paying attention to and preventing any type of a patient risk or family, visitors, etc. And staff.
Right.
And staff.
Makes sense. Okay, very good. Cindy, let me turn to you a little bit about the same type of thing in your area. What types of things are you watching for or working with your folks about patient safety this week?
So some of the things that we've put in place. So we have as Suzanne was mentioning, patient falls.
Right.
So we have a team that meets monthly. It's called the Fall Prevention Review Team. And we monitor all patient falls. We look for trends, etc. We have implemented, we're going to do a trial on the medical floor to prevent or reduce our falls. So on the ceiling tile, we're going to change it out to a sign that says, please call, don't fall, to remind patients that may be confused to make sure and use the call light for assistance to get up to the restroom, etc. So we're always looking at things to improve,
Right.
and for
Okay.
patient safety.
So on the ceiling tile, I guess over the bed then, I guess is what
Yes.
you're saying? So if I'm
Yes.
lying there, I look up and I'm like, oh yeah, I should just call someone to help me instead of
Correct.
trying to make my way to the
So-
bathroom or wherever I want to
Correct.
go.
We're in the process right now of implementing that. So
Okay. That makes sense. And let me turn to Cynthia Brandt about in the lab area. What types of things are you watching for and talking to your folks about?
Well, as representing ancillary services, we have to do major patient identification processes to make sure when we collect a specimen or when we do an x-ray or when we do a therapy treatment of any kind that we've identified the correct patient for the correct service, and the results that come out every day are helping our physicians treat those patients and our nurses treat those patients so they can get out of the hospital as quickly as possible.
I see. And a lot of folks may forget just how many people, literally people are coming and going from the hospital, how many employees you have. I mean, it's in the hundreds, I know, each and every day. And so this is a big undertaking, right, to try to get this out through all levels of staff and through all departments and things like that. Suzanne?
I think that one of the things that we really want people to key into is really that situational awareness. You know, something that we all as individuals, we take that, in our travels, going to the grocery store, walking across the parking lot, but really paying attention to those small details, because those small details are the ones that, when you miss them, are the things that cause or can lead to some sort of injury or harm. Simple things sometimes really make the most difference.
Right. And so this has been going on now for a number of years, right? This extra focus on patient safety, not just at San Juan Regional, but at hospitals throughout the country, throughout the world, I would think.
Absolutely. There's a huge focus nationwide on prevention of harm. That is, well, we call it preventable harm. Harm. And the Centers for Medicare and Medicaid, which is a purveyors of Medicare and Medicaid services, they advocate for prevention at all levels. And so you're really looking at not just mitigating it, minimizing it, but really what are the things that should never happen to somebody. A patient fall is really considered something that should never happen in a hospital environment. And so really encouraging people, like Cindy said earlier, to utilize the staff to help them. And sometimes that's, people want to be independent. They want to feel comfortable. It's like, no, I feel better and stuff and getting up on their own. But I think that you can be unaware of how weak you might be. And really put yourself at risk for a fall.
Sure.
So.
Very true. Well, and I can remember back in the day when you'd get wheeled out of the hospital in a wheelchair, wouldn't you? They wouldn't let you stand up until you got out the front door.
Right.
Does that still happen?
Actually, we really prefer that people be escorted out and stuff
right.
to assure that they're comfortable. Particularly if you're standing up, your hospital stay is much shorter than it used to be.
That's true.
And that's a national trend. So you are standing up after you've been maybe in bed for long periods of time. And it really makes a difference about how weak you are.
Right. And so this idea goes, again, all employees are expected to be aware of these policies and these rules and some of the education things, from maintenance to the mailroom to the doctors and the nurses.
Yes, everybody. We have what we call safety tools. So we have a little toolkit, and it's things like stop, think, act, review. So STAR is a tool, and we want people to apply that when they are doing something that maybe is very familiar. So it's a familiar task, something I do every day. But if it feels wrong, it is wrong. And so to really think about what's happening and what am I facing, instead of just doing things by rote, really giving consideration to your tasks.
And that can be difficult. I know even in other office type situations or other job site situations, when we do something over time and time again, it becomes almost routine, and that's where the potential for problems could spark, right?
Absolutely. And I think, we think that we're so used to things that we really know best. Something Cynthia was talking about earlier about being able to identify your patients well. So we have what we call a final check. So you have the patient state their name, their date of birth, or the last 4 digits of their social security number, and then we utilize that to identify them. But after that lab specimen is drawn, before you put that label onto that tube, you are doing one final check where you are actually comparing then that stated name and date of birth to that label, and it's called a final check. And it seems, when we first instituted it, there were many people who thought it felt unnecessary, but honestly, we know that it has prevented mislabeling of samples. We know
Interesting.
that it has.
And I imagine the patient feels a little more confident too, because you're double checking or just checking with them, and they know that they're getting the right medicine or whatever, or procedure or whatever it is that they're supposed to get.
I think it's important that we communicate why we're doing things. Sometimes I think that the individual might wonder, well, why are you asking me again? Did you not remember that I told you my name? But we're not double checking you. We're double checking that we're not making that mistake.
Right.
So we're validating for ourselves.
Right. Interesting. Cindy, let me turn to you again a little bit about working with your staff and same types of things. Are there some checks and balances and things like that your folks go through as well?
Correct. So some other safety tools we use are, it's called ARC. So it stands for Ask a Question when they request a change. Now I'm drawing a blank.
They can ask a question, and that's your staff asking a question, or the
Yes.
patient asking a question?
No, the staff.
Your staff, okay.
So let me
Right.
give you an example. So
Yeah.
if a provider ordered medication that they had a question about the dose, they can ask that provider for clarification, request a change, etc. And if they're not getting what they need, they can also then go up the chain of command. That's what the last C stands for.
I see.
Read back. Policies and procedures are another safety tool. SBAR, so we use that in communication. So situation, background, action, and then recommendation. So that's another tool we use for communication, whether it's shift change, provider-nurse communication. So yes, all staff are educated. Not only clinical staff, but your ancillary staff as well, about how to use those tools.
Right. And that's so important, I suppose, when you're dealing with multiple patients with multiple needs and issues on different floors and traveling around the building.
Correct.
I suppose. Interesting. Okay. And Cynthia Brandt, let me turn to you a little bit about some of your work as well. And so same type of thing. There's some checks and balances in your
Absolutely.
area as well.
And I think one of the things that was most important to us was that we treat them like our family, okay? If my mother or my father or my sister or my child was in the hospital, I'd want them to be safe. So if they are safe, then our patients are safe. I want to give a really good example of something that happened up at our ODC office. We have 2 phlebotomists up there right now.
And ODC, I'm sorry, is
the
Outpatient Diagnostic Center.
the Outpatient Diagnostic Center. That's on 30th Street.
Yes, it is.
There you go. Okay,
Yes.
I'm with you. Yep.
So they have the same group of patients that come every day or once a week or once a month. And when they notice changes in those patients' situations, they bring it to the patient's attention or to the physician's attention. In the specific case, this wonderful woman was not feeling herself, and her husband was trying to get her to go to the hospital and get checked out. And she didn't want to go, and our person talked her into it. She ended up getting admitted to the intensive care area. She was really sick. So she was grateful that he talked her into it. The husband was grateful. Everyone
Sure.
was grateful. So we have to put our patients' safety first and treat them like our family.
Right.
So it's very important.
But this is an example, I guess, too, that it extends outside of the 4 walls of the hospital proper to your
Absolutely.
other clinics and buildings and other offices throughout the community then. And this is something that is, I guess, throughout the entire institution, right? That the rules and things are stated that folks need to follow and things like that, Suzanne?
Yes, absolutely. It transcends all the environments, not just the hospital. I think oftentimes we think Sound Regional Medical Center is the hospital, but there are many, many outpatient clinics, the urgent care center, ODC, etc. And so all employees are really taught those tools and are expected truly to utilize them and apply them in all of their situations. So if you were, say, at a clinic visit, you would expect that you would have those same questions validating your name and your date of birth and validating who you are before a lab sample was drawn
Sure.
or a test was performed to assure accuracy and safety.
And all these things, I imagine you're gathering data on these things, on the falls and on the potential problems or problems that are resolved or not don't happen. And so these are used to kind of track how you're doing and things along that line too?
Absolutely. There are certain metrics that must be reported to the Centers for Medicare and Medicaid. There are expectations for routine reporting. And so we collect data on any number of things. The falls that Cindy spoke of earlier, sometimes we collect data on skin injuries that might happen, on errors, medication errors, or on infections that are acquired within the hospital. And so we monitor all of those things very, very closely. And we communicate that internally to our employees by what we call the harm score. And so we don't call it a safety score. We call it a harm score. Because the truth is we're looking at the number of harms that have occurred to people, real people, in our care. And so that score is a metric, is a measure that accounts for the number of times where we may have inadvertently, but nevertheless caused an injury or an infection to a patient.
And that goes out to everybody.
Goes to every employee. And
I guess that transparency is important, right? So they can see how you're doing, and obviously lower is better.
Absolutely, lower is better. And the truth is, I think the transparency is important because we want people to take pride. No one ever goes to work with the intent of ever harming someone and stuff. And so if you're not attentive to detail, that's when it happens. And so that's why the tools and the situational awareness that I was talking about, all of those things are so very important because they are all about prevention.
Very good. My guest this morning from San Juan Regional Medical Center, we are talking about Patient Safety Week, which is going on all this week at the hospital throughout San Juan County and its properties. We're going to take a short break, everybody, but when we come back, more with my three guests in just a moment here on KSJE. The time is 8:28. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505-599-0181. KSJE is supported by San Juan Regional Medical Center, your community hospital with a rich heritage that dates back to before New Mexico was a state. We've been improving the health of the Four Corners since 1910. As a nonprofit hospital, San Juan Regional Medical Center is a values-driven organization. We strive to deliver on our mission to personalize health care and create vitality and enthusiasm in healing. We are here for you when you need us, offering a comprehensive range of inpatient, outpatient, and emergency care services. Again, I'm Scott Michlin. My guests here on the radio from San Juan Regional Medical Center, where we're talking about Patient Safety Week this week. Joining me here in our studio again, Suzanne Smith is here. She is the Chief Nursing Officer at the hospital. Good morning once again.
Good morning to you.
Thank you for being here. Also, Cindy Byes is here. She is the Director of Clinical Services. Good morning to you.
Morning.
Thank you for being here. And also, Cynthia Brandt is here, Director of Laboratory Services. Good morning to you.
Good morning, Scott.
A full studio this morning. We're using all of our cameras here, which is very exciting. So thank you all for being here to talk with me about this Patient Safety Week, which is so very important. And as we've been talking, it's all about keeping patients safe when they come to the hospital, whether they are, whether they're a patient or a visitor, or it doesn't matter who. Safety pertains to everybody, right?
Well, safety applies to everybody. So patients, their families, visitors. There are a lot of outpatient services that occur at the hospital. So a lot of people who are, coming in just for very brief periods of time to have testing done, and then also our employees. Certainly not the least of which we value their safety also.
Very true. Very true. We were talking during the break a little bit about safety advocates. And so talk to me a little bit about what those people are.
So we have what we call safety advocate program. And it's not a temporary thing. Once you become a safety advocate, you really are making a commitment, we hope, for your lifetime. Mm-hmm. And so it really is a focus on not just the tools that we utilize for safety adherence, but also really to garner some enthusiasm and some confidence to be able to speak to things. So like if you see something unusual happening, to really have the temerity to say, I see this, and I'm going to stop the line. I'm going to intervene. I'm going to warn. I'm going to call it out so that I can help stop that. And so really we work with people to increase their confidence so that they have that ability to speak out and to be comfortable and confident. So we do a program of probably about 30. I think there's probably 30 people in each class, we call it, and spend a whole year with them really working on these different tools and gaining that skill set. And then we have a little bit of a graduation and celebrate their successes. And then we bring in a new group of people. And so really it's a role that you take on forever.
Interesting. And the whole idea, too, I think, at the hospital is to empower all of your employees if they see something that could potentially cause a problem or be a problem to speak out or tell somebody, as you mentioned, stop the line. So you kind of, if there's a procedure going on, you have the power to maybe stop that as we take a second look at it.
Yeah, absolutely. And we want people to feel empowered to really make a difference. And there's in all work environments, there's going to be essentially a chain of command. But we want the individual at any level of employment to feel comfortable and confident that if they see something that they know is wrong, again, to be attentive to that detail. And if they see something that is wrong, that they feel confident that they can say something, that they can stop something so that we don't, and it doesn't matter if it's to a physician or to myself, somebody on the senior leader team. We really want people to feel comfortable being able to speak out.
And that's somewhat unique, I think. It doesn't happen in every workplace.
I don't think it does happen in every industry and stuff, but I think that the responsibility that lies with healthcare is one of, it's great. We have the responsibility to help people, to do no harm.
Right.
And so if we don't all take part in it, then it is not as likely to succeed.
Sure. And let me ask our other guests about that same thing. Cindy, same type of thing. I mean, is that empowering for folks in your area to be able to go up to someone maybe at a higher level at the hospital and say, if they truly believe something's wrong, to say, hey, we should probably think about this or take a look at some stuff?
Yes. For example, if a nurse is in a patient room and they're supposed to be washing their hands, hand hygiene,
right,
in and out, maybe a housekeeper or a nursing assistant notice that they didn't, they can stop them and say, I noticed that you did not wash your hands when you exited the room. We want to make sure our patients are safe, so that nurse that goes possibly to the next patient room may have contaminated hands. So, yes, at every level.
It's important.
It's important. So.
Right. Okay. And Cynthia, same question, I think, to you in your area, same type of thing. Someone can come up to you and say, hey, I don't think this is right, or I don't think we missed a step, or something, we might double check something.
Right. For us, especially with our phlebotomists and our processors of specimens, we have to be sure that our hand hygiene is excellent, that when we come in, we properly identify the patients. We don't turn out wrong test results on wrong patients. They don't receive incorrect results, incorrect treatment, incorrect diagnosis. Is just so important. And it's the very first step for us to be sure that the patient is safe and that we come in and we treat them safely.
I suppose in your line of work, if a sample gets contaminated or there's a problem, it could lead to if it's not caught, it could lead to other issues down the line.
If a specimen is contaminated, the results are absolutely inaccurate, and it can lead to incorrect diagnosis, incorrect treatment, incorrect amount of treatment. So it's very important, and we treat these people's, the phlebotomists, the processors, the assistants. What they say is very important to the technologists and to myself as we work.
Sure.
So very, very important.
So good policy to stop it before it starts.
Absolutely.
And for all of you, I can see that. So very interesting. Safety huddles, I want to ask you a bit about that. Sounds like you're on a football team.
It does sound like a football, and maybe it is a little bit like that.
Right.
So we have safety huddles at truthfully every level within the organization. So departments start their day with a safety huddle. So that would be, say, a nursing unit at shift change when you do the handoff. And we do our handoff at the bedside. And that is an expectation because you are including then the patient in that discussion. This care is about the patient. It's about their well-being, their goals for the day. And so it does provide then an opportunity for the patient to communicate information that they maybe hadn't shared, or for them to ask questions of the staff. So we do our handoff at the bedside, and then the nurses have, at the start of their shift, they gather up and they talk about things that might be of, sort of high priority, if you will. Maybe there's a patient who's been identified as being someone who's at high risk for a fall. Maybe that's someone who's confused or agitated, and so that then everybody is alert to that. So that patient is not is truly assigned to the care for one nurse, but really that patient's everyone's responsibility. And so then everybody is familiar on that unit and is as particularly attentive to that information. Even in the housekeeping department, they have a morning huddle or an evening huddle, shift change huddle,
right.
And they talk about the things that they need to focus on for their day. So it really gets people started, sort of sets up your day with a positive start.
And I suppose if someone is maybe agitated or easily confused or something, it's maybe good for your staff to know that before even going into the room, of what to expect or how to maybe approach that patient, because it may be a totally different way that you would do that as opposed to someone who's maybe completely aware of where they are and what's going on and what's happening, kind of a thing.
Well, I think really, the nursing staff, phlebotomy staff, housekeeping staff, anybody who's in that patient's room really needs to be aware, because everybody has the power to interact with that patient, to calm them down, to be gracious and to be friendly. And those things really do help calm a person down. But a highly agitated patient does, pose a risk to themselves for falling.
Sure.
For falling, they absolutely do. So yes, being aware absolutely makes all the difference.
Makes sense. And we've talked a lot this morning about how you talk to the patient, confirming information, names, social security numbers, and things like that, just to make sure that the double check of medication or treatments or what have you. My question would be, what if the patient is unable to answer those questions? Maybe they're unconscious or they're still getting treatment. Is there still another way to double check these types of things?
We, for the patient who's not communicative, we, and that might include children, small children, for instance, or individuals who are confused. We rely on a couple different factors. We rely on family for initial identification, and then we utilize photos. So in our pediatric department, for instance, we take a photograph of every small child, and we use that as a comparative, because if the parent is not there, and we welcome our parents to stay, but not everyone can stay.
Sure.
And we have to understand that. And so if a parent's not available, then we utilize that photograph as that identification comparative to assure the identity of any individual child.
Gotcha.
And the confused adult, or non-communicative adult.
That's what you can use in that case as well.
Yes, absolutely.
Interesting. My guest this morning from San Juan Regional Medical Center. This is Patient Safety Week all week long, and this is not just at your hospital. It's all over. It's all over the country, is it not?
Nationwide.
This is a nationwide observance, and of course, patient safety is something you deal with year-round. But this week specifically, you're focusing more attention, I guess, onto the programs and policies that you have in place to ensure patient safety.
I think we want to draw attention to it, not just internally, but most especially internally, just to remind people to acknowledge it and to celebrate it, but also really to communicate to the community at large that we value that and that we attend to those details on a routine basis.
Right. Very good. We just have a couple of minutes remaining this morning, everybody, but I know we were talking during the break a little bit about some services that people don't even have to get out of their car necessarily for if they come to the hospital. One, of course, is the very popular flu shots that you can drive to and just roll up your sleeve and roll down your window and boom, there you go, right?
Yeah, provide a little information, sign a consent form, and you can get a flu shot while you remain in your car.
Right.
Very popular.
It's like fast food, right? It's a drive-through flu shot.
Yes, that's a great connotation. Yes, it is like fast
healthier,
food.
maybe a little healthier than fast food. We'll put it that way. But that's one way. But you were saying to me too that you do some take blood maybe from someone's car.
Yeah, Cynthia had shared a story with me where an individual patient who may not be as mobile and has a difficult time getting out of their car, and so her phlebotomist will come out of the ODC and they'll register that patient at their curb, and do their phlebotomy or draw their blood from their car, so the patient doesn't even have to get out of the car.
Interesting.
to assure their safety.
Cynthia, let me ask you a little bit about that, and that's something that is okay to do, I suppose.
It is,
right?
as long as you have your registration person and your phlebotomist that's using good safety techniques. So again, it's a culture of safety, a culture that we take care of our family and safety first always.
And the issue is just that maybe that individual may not be able to safely walk into the
Exactly.
the office to have this done, and so it's easier for your staff to go out to them.
Absolutely.
Is kind of what you're talking about.
Absolutely.
But interesting. So that's just one more example, I suppose, right? And there was another thing we talked about during the break, which is it Houdini protocol? Am I remembering that correctly?
Yes.
And so, Cindy, talk to me a little bit about what that's all about.
So in order to reduce...
You make people disappear?
Not quite.
No. Okay. I didn't think it was that. That's where my mind goes. See, so I'm glad you're here to set me straight.
In order to reduce catheter-associated urinary tract infections,
Right.
we have a Houdini protocol where a nurse completes an assessment, and if they no longer require that Foley catheter, the nurse can discontinue it without the physician order. So as soon as it's not needed, let's pull it out to reduce that risk of infection.
I see. I couldn't have been more wrong as to what I thought that was all about, right?
And
So-
Houdini actually stands for multiple things. It's the criteria.
Right.
H is for hematuria and et cetera, hourly
It's an
output.
acronym. It's not the
Correct.
magician. I
Correct.
gotcha. See where I went
So-
with that? So I appreciate you being here to set me straight. But that's another easily remembered protocol, I suppose, right? When we're talking about things like that.
Yes.
So that's interesting. And that's just one more area of safety that you all are working on.
Correct.
So-
to reduce that harm, patient harm.
Right. Right. Very interesting. Okay. Well, thank you. Anything else you want to mention before we run out of time this morning, everybody, about Patient Safety Week and some of the things that we're talking about? Cindy?
One more
Yes.
thing that we do. This is not new. We have done bedside medication verification for a number of years. But with our new system, yes, we continue that. So when nurses go into the patient's room, they're making sure by scanning the patient's ID band and the medications, then we're assuring that the right medications are given to the right patient. So that's another level of safety.
I see. And that's important as well.
Yes.
And I know recently the hospital started up a new electronic health record system, and that has been kind of being implemented over the last few weeks or so. And
We went live January 19th.
January 9th, we did a show about it. I know, and that's true. And so, like any new system, it takes time to get used to it. But this idea was, as it was explained to me, it kind of combines a lot of older systems and older different
Yes.
platforms into one to make things a bit ideally easier for
Correct.
your staff to use. And so, is that
That's
proving to be the case?
Yes, it has. So our clinics have the same system, so we can see those medical records, ED, so you can see what happened in the office in the ED, all the way to
That's emergency department,
emergency
right?
department, intensive care unit, the unit, medical unit per se, and then maybe even then to our rehab hospital. So it's a continuum of care with that one medical record.
And the staff can see all those things and I guess make notes
Correct.
or kind of make additions or notations as to how the patient is doing or reacting to certain treatments or medications or what have you. And everybody can see all that in real time, I
Yes.
suppose, or pretty close to it.
Yes.
And that's a big change from what you had before.
Correct. You would have to go here or there or to see the different records from different entities.
Right. So a big change and
Yes.
improvement at the hospital. So
It is definitely a big improvement.
wonderful. Well, I can't thank you all enough for coming in this morning and talking with me about the importance of patient safety and visitor safety and just overall safety when we talk about healthcare these days. And it's something that I know is very important for patients and visitors at the hospital and your staff as well. It's something that apparently you live, breathe, and eat every day, sounds like to me.
Yeah, absolutely. Safety, we have what we call service standards, and safety is, of course, that very first one. And many people use it as their catch line, right?
Right.
Safety's job one. Well, it really is in healthcare. It has to be.
Yeah, very true. Well, thank you all very much. Thanks for coming in.
Thank you for inviting us.
You're very welcome. My guests here on KSJE from San Juan Regional Medical Center. We were talking about Patient Safety Week this week. And I'll be back with more in just a moment, everybody. The time right now is 8:52. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505-599-0181. Wednesday morning here on KSJE, and it's time to take a trip to the Encouragement Lab. That's where Communications Professor Dr. Mike Hattabaugh is standing by. Good morning, Dr. Hattabaugh.
Good morning.
Thanks for being with us. And this starts a three-part series with you and me on authenticity today, right? Beginning this week.
Exactly. Yeah. Authenticity. You know, authenticity is the new everything.
Is it? Okay.
Our culture has really, you know, with all the fakeness, we're just tired of, you know, fake models and, you know, photoshopping everything. And so we've become a culture now that we expect authenticity. So you need to learn how to be authentic, and you will be more well received by others. So that's what we want to talk about the next few weeks.
Interesting. Okay. And so today we're just starting with the topic of being real, right? So
right, which is kind of at the root of what authenticity is, right? It's just saying, look, I'm just going to be me all the time. What you see here on camera or listen to on the radio, that's who I am. I know you, Scott, well enough to know that you're the same guy on the radio that you are off the radio, and that's authenticity. And, you know, you're not some prima donna that, you know, has to, you know, be chauffeured around, and right? You don't do that.
Well, they wouldn't put that in my new contract, so you're right. I didn't get that. But yes, that's true.
But we did talk about where you park when it snows, but that's a whole different issue.
That is a whole different issue. That's true. Exactly. But right. And so that's got to be a little bit difficult in this day of social media and Facebook, and some people maybe try to present a certain image of themselves in social media, maybe more than they are really doing in person. Right.
Well, something like 70% of the people on, you know, these dating apps,
right?
70% of the profile pictures are not a picture of the person that's there, or at least it's one from 10 years ago. I was watching a doctor on YouTube, and I watched a video of his, and I was like, okay, I might want to subscribe to his channel. I go to his channel, and the picture of him is like 20 years old. I'm like, that's not the same guy. It's 20 years ago. So realize that we're now. You can try to do that, but in an age where there is so much I mean, just put in my name on the internet and watch what comes up. It's crazy because there's so much access to information. Now, you can try to control that. Good luck.
Right.
You got a lot of money. You can pay people to control it. But the reality is you can't hide stuff anymore very well. So you might as well say, you know what? This is who I am. And if you carry that persona, people appreciate that now. And we're going to talk later about what that looks like. But the whole point here is just, if you'll just allow yourself to be real, that's a whole lot less work to wake up in the morning and say, you know what, I'm going to be the same person all day today that I am, whether I'm at work or at home or with friends or out in public. I'm just going to be the same person.
And that provides untold benefits, I suppose, right? As if you are changing to that and starting to do that more often in work, at home, and friendships and relationships, right?
Yeah, and realize there's two sides to this. So not only am I not going to be plastic when I'm out in public, I'm going to be real. You know, like see, it's real for me to show that my undershirt's a little different color than my shirt here.
Yes,
that's being authentic. See,
okay,
just pointing that out.
Thank you.
Out. But the thing is not only not about being plastic, it's also about saying, you know what, I also can't be abrasive in private. So we all have heard stories about somebody that seems to be a really nice person, and then they, you know, the CEO of the San Francisco Giants just got caught treating his wife horribly. He was shoving her and got caught on video doing it. And now he's had to resign or step down from his post because turns out he wasn't that same guy with his wife as he is the rest of the time. And people are like, oh, we can't tolerate that. So that's what I'm talking about, is being the same person. Both don't be too syrupy sweet on one end, but also you better watch it because everything you do now is being watched. So quit treating people poorly.
That's very true. All right. And easy to do, right? You could do that. You can start that now.
Just being real, yeah.
Okay. All right. Thank you for keeping it real, Dr. Hattabaugh.
All right.
We'll talk to you again next week.
See you then.
All right. That is Dr. Mike Hattabaugh. He is with us every Wednesday from the Encouragement Lab right here on KSJE Farmington. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.